I hate when this happens. I don't know about you, but when things go wrong, I don't like it. And they often do go wrong. I'm a periodontist. I do surgery. Not every procedure works out great. I don't care what they tell you, but implants don't have a 100% success rate. Patients don't show up for all their recall appointments. Matter of fact, most of them don't. Only 15% do. So what do you do? I mean, because I'm sure you've had this experience. What do you do when things don't go well? Whose fault is it? Is it your fault? Is it the patient's fault? Is it your team's fault? Is it God's fault? Because it does happen. So we talk about this often, informed consent. When you tell someone in advance, we call it informed consent. When you tell somebody after, we're making an excuse. Well, I try to give an informed consent with every one of my new patients and every one of patients before we go through surgery and for everything that I do. Oftentimes, patients don't hear or realize what they're signing. They say, you never told me this was going to happen. Well, we did. And it's not really the patient's fault. It's really my fault. Because if I tell them and they don't hear it, whose fault is that? I didn't communicate, perhaps. You know, everybody will say to you today, I left you a voicemail. I left you a text. Oh, you didn't get my text? Oh, no? I called you back. Well, that means I had to listen to it. That means I had to read the email. That I had not only had to listen and read the text, I had to understand it, and I had to take appropriate action. You know, we get so many pieces of correspondence coming to us on a daily basis, hundreds, whether it goes into spam or junk or email or voicemail or text, or people yelling to you from the window as you walk by their house, hey, have you done this yet? It's really overwhelming. And I think today one of the biggest problems that we have as humans is communication. And we may think we communicate, but oftentimes we don't. So I have an expression. I said, if you send me an email or a text, that's just one-way communication. And people think that they've done their job. Today, one of the things that I find is that people are so busy, they think if they call you back, they've done their job. If they call you back and you don't connect, because now it's your turn to call them. That's not really very good communication. And with my patients, it can be very dangerous. So when a patient has a problem and they said, well, I didn't know, it's probably my fault for not communicating well. And how does it become my fault? Well, a patient comes in on a day that I'm not there. They get a cone beam CT scan. They're scheduled for surgery. I didn't review the cone beam CT scan because I didn't know the patient was in that day. And my team didn't tell me. You know what amazes me? We see on a daily basis anywhere from, 20 to 50 patients in our practice, sometimes maybe more. We have 3 hygienists and we have 2 to 3 periodontists. So there's a lot of people coming and going. I'm surprised more things don't go wrong with all of the possibilities for human error, because we have a protocol for everything that we do in our practice, and we try to follow through with those protocols. And one of the protocols is to give a patient informed consent, to tell them in person, and to have them sign it. Now, when we do informed consent over the phone, it doesn't work as well. When someone wants the treatment plan over the phone, it doesn't work as well. I got a call from a patient just about 25 minutes ago. He was supposed to show up for a post-operative check. We're going to treatment plan him for an overdenture in the mandible. Unfortunately, he has some medical problems. He lives an hour and a half from the practice and he has Parkinson's disease. So he called me up and he says, I can't make it today because my Parkinson's is acting up. And because of that, I just like to do the consult over the phone. So we start talking, and I realize he needs a couple more teeth out. He needs 2 or 3 implants, and we're going to make him an implant overdenture. Means I got to manage the prosthetics, I got to manage the surgery, I got to manage the extractions, I got to manage the medical consult, and he wants to do this on the telephone. Now, I've done this so many times in the past that I will never do it again. I refuse, and this may make me different, but I refuse to schedule somebody over the telephone for a surgical procedure unless I get to see them, unless it's an absolute emergency, because oftentimes things get lost. And after talking to him for 10 minutes on the phone with his wife in the background, I said to him, I think it'd be best if you come in. Now it's spring now. It's a nice drive. It's only an hour and a half away. It comes through the nice wooded area to come to the office. Find some time when your Parkinson's is not acting up. Let me see you. Take a cone beam CT scan. Take a series of x-rays, a digital scan, etc. And let me work up the treatment appropriately so that I can do the right job for you. I know I would prefer to do it over the phone because it's easier for me. I don't have to see the patient. I have no time in my schedule. I'm booked 4 months in advance. But this would be a disservice to the patient. By doing a disservice to the patient, by not communicating well, things go wrong. And oftentimes patients want to do the wrong thing. And one of the things that I oftentimes say to patients, I'm here to save you from making a decision that's not in your best interest that you want to make. I have to save you from yourself. If you have children, you know what I'm talking about. It's 4 o'clock, you're in the mall, dinner's at 5, but they want ice cream. Daddy, I want some ice cream. I go, yeah, but we're eating dinner now. I want it now. Sorry, I'm the adult, you're the child. With our patients, we're the adults. They're not children, but we are responsible for ushering in their great care. So, next time something goes wrong, look at yourself first and realize it probably comes down to communication. And as Brene Brown says, which we'll talk about in one of our future videos, being clear is being kind. And there's too much unclarity today in the world, and that's where most of the mistakes happen. Hope this was helpful. Maybe it was, but I think it was because this is something that I believe very strongly, the importance of clear, precise communication. Have a good day, everybody. And remember, be the gift.